The numbers are staggering: 530,000 dead, 30 million infected. Even in the face of such pain, there is hope 365 days later. Good evening, and welcome to our monthly special edition of the Daily Drum in partnership with our sister station, WHUT TV. Last March 11th, when the World Health Organization declared the coronavirus a global pandemic, no one could have imagined the toll would be so widespread. Millions unemployed, scores of businesses forever closed, and schools still struggling to reopen. But there is light at the end of the COVID tunnel. Vaccinations are ramping up, restrictions are being lifted, and many Americans are feeling a lot more optimistic. So, what's next? And how close are we to fully returning to normal? We have a lot to unpack tonight, but here's what we hope to accomplish: provide you with a better understanding of where we are in this global pandemic and a realistic approach to where we're going. My guests over the next hour have the credentials to answer those questions. Let's begin with our first panel. Dr. Reed Tuckson is co-founder of the Black Coalition Against COVID-19. He's been on the front lines educating our community about the coronavirus. And Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin is also known as one of the nation's most influential physician leaders, speaking about health issues impacting our nation today. Gentlemen, thank you so much for joining the program. I really want to start with you, Dr. Tuckson, to kind of set the stage as to where we are. In the DMV, DC, Maryland, Virginia, we have differences border to border. We have differences state to state. Virginia is different. North Carolina is different. Georgia, Texas. Where are we, from your perspective, where are we medically?
We are in, as you almost described it so perfectly well at the very beginning of the show, we're in the middle. We absolutely are in a place where we can see the light at the end of the tunnel. We do know that in most places in the country, the experience of infection and infectivity has been holding steady at a rate that is still too high, but at least holding steady. And that's very encouraging. We're also at a place, as you have mentioned, where we now have the availability of 3 vaccines that are highly effective and very safe, and that are now being rolled out across the land. And we will have very robust supplies in, I think, short order. So all of that is very good. What is of concern is, number one, too many people think that this is now the time to relax their vigil. And we're seeing states opening up, I think, in very irresponsible ways. And there's no bulletproof shield that isolates the rest of the country from those states that have been, I think, enacting inappropriate letting down of their guard. But number two, we have these variants. And these viral variants are of great concern. We have particularly the one from the United Kingdom, which will in short order become the dominant strain. And that's important to our audience because it is more easily transmitted, and it can make people sicker. And so that is of great concern. And meanwhile, we have other variants that are becoming homegrown. So what we are now, to summarize where we are in a flat out sprint to the finish line, where we're trying to get in time to enough people to be able to have what we call herd immunity, just enough people vaccinated so that this virus has no more fuel to burn before the variants take over. This is a flat out foot race to the finish, and it requires everybody to be vigilant until we cross the finish line. It's almost like how you get a guy who catches the touchdown pass, gets to the 5-yard line, starts celebrating, and drops the ball. The other team runs it back for a touchdown. I am very worried that that's where we may be.
But what are the speed bumps in this sprint to the finish? We have seen what's happening in Italy. Italy was one of the worst countries hit by the pandemic early. They're shutting down again. What kinds of problems do you see in this sprint to the finish?
Well, I think the key problem is two. Number one, it is whether we will have enough vaccines that are available and delivered into communities so that we can get shots in arms. And for the Black community, The speed bump is particularly important because there are so many small bumps that limit our ability under normal conditions to have access to the tools we need to save our lives. So we'll have to be very vigilant. And the second speed bump is people giving up too soon and people deciding that now is the time for them not to wear their masks, not social distance, not avoiding congregating indoors until we really are ready. Those are the two biggest speed bumps that I see.
Dr. Benjamin, it was in March of last year that, as we said earlier, that the WHO said this is a pandemic, a global issue. Would you still consider it so, even though we are seeing some improvements?
No, we absolutely still have a pandemic. This is a disease is still worldwide. And it is still ravaging several countries. You know, you still have a rampant outbreak in Brazil, for example. You still have a rapid outbreak, as you said, resurging in Italy. There are several other nations where we've just plateaued. The United States is fortunate that we're seeing a big reduction. But as I think Dr. Tuckson so eloquently said, it is, you know, we've kind of plateaued at probably too high a level. And so the concern is that not only are parts of the world letting their guard down, but even though this vaccination process has started, and by the way, we're doing reasonably well in the United States in terms of vaccinating people, most of the world has not gotten much vaccine.
So, well, with that said, and you said this is a global issue, we are part of the global family. So we are included in those numbers, even though the United States in some ways is doing better than some of those countries that, as you said, have not received the vaccines.
Well, we're still, as you know, we're still the highest nation in the world in terms of cases and deaths. We still had, quite frankly, a very incompetent response, considering the wealth and prosperity and the health infrastructure of this nation. So we're by no means out of the woods. And even though we are doing a reasonable job of vaccinating, and I want to say reasonable, we still have lots of challenges. Dr. Tuckson pointed out the lack of an adequate amount of vaccine, although let me just say it's rapidly increasing. But getting a vaccine and getting that vaccine in people's arms are two very different things. And we've already seen the disparities that we had both in the disease and in the testing. We're now seeing in the vaccination delivery. And we've got to do a lot of work to make sure that we reduce those disparities.
Dr. Tuckson, are you concerned about what we've seen over the past several days with the spring breakers, the college students who are in South Beach, in Daytona, in the Florida Panhandle, acting as if there is no COVID-19 pandemic? When you see those pictures, what goes through your mind?
What goes through my mind is that if we have learned anything from this pandemic, it's shown a very bright light on the relationship that each of us as human beings has to those who share our time and space. The relationship between what I do and how that can affect someone else. The idea that we can spread unknowingly an invisible virus that can sicken or kill another person somehow in these young people's mind is not important. That their lives, their chance to party and have a good time is more important than their ethical, moral responsibility to other human beings. I simply have no words that can express the disappointment and the concern about our society going forward. Who are these people going to be, and what is our country going to be when they grow up? The idea, again, that we know that the inevitable result of their behavior is that people will become sickened and they will die, that they will spread this further, not only in that local Florida environment, but they'll bring it back home to others. And who knows which variant they will be bringing with them that may cause us not to be having our vaccines effective. And so, Harold, I think what it really says to me and what goes through my mind is absolute outrage, but also a tremendous sadness for the future of this nation.
Since the very beginning of this pandemic, Dr. Tuxen, you've been trying to get the message out to communities of color, specifically the African-American community. It's been a year. Are they getting the message? Black communities are still lagging way behind when it comes to receiving the vaccine. Is that about hesitancy, or is that about access? Your thoughts about that?
Quickly, to disentangle a couple of interrelated points. Number one, the vaccine hesitancy issue for African Americans has flipped 180 degrees. We, a few months ago, were seeing statistics as high as 70% of the community not being interested in being vaccinated. Now we're seeing 70% either are ready or are almost ready, and they just simply want more information. So this idea of vaccine hesitancy, while still important, is very, very different today than it was even a month ago. We also are seeing, as you've indicated, lines of African Americans all around the country trying to get the vaccine and having, unfortunately, the low supply keeping it out of our shoulders for the moment. We're also seeing a huge amount of frustration in the African American community to be able to actually register through the various internet sites to get the vaccine. So the point of it, Harold, is that we should no longer allow any policymaker to deny our communities access to these doses for the myth that says that we don't want it. That's a bunch of hokum. And by the way, the number one group of people in America today who are vaccine hesitant are white Republicans. It's the Trump cultites who are the ones who are more than African Americans. So let's make sure we understand our people are beginning to get it in overwhelming numbers. We know we cannot go back and live our lives, have our small businesses open, have our kids back in school, be able to go to the family barbecue, go to church. None of those things happen unless we can get our community vaccinated, and our people are beginning to catch on, and that's very exciting.
Dr. Benjamin, do you have any friends, and you are part of this sprint to get to that light at the end of the tunnel, but do you have friends, associates who are not in the medical field at all, who have nothing whatsoever to do with this COVID crisis, who are hesitant? And if so, what do you say to people who are still hesitant? Because I still have friends who are, and I've already had my shot. My parents, they've had their shot. But I still have some friends who just say no.
You know, one of the things that I recognize is I tell them, look, it's okay to have questions about the vaccine. You know, when I was practicing clinical medicine, I always shared with my patients that, you know, what are your questions? What do you need to know? I'm going to prescribe you this. This is what the medication does. This is how it would make you feel. You know, here's my number. If you need to call me to ask me any other questions. Vaccines are no different. So we ought to recognize the fact that people do have questions. Secondly, I acknowledge their historical concerns. So I try to do more listening than talking. And I say, you know, what are your concerns? Then I try to directly answer those concerns. So if they talk to me about Tuskegee, we talk about Tuskegee. I remind them that Tuskegee was a terrible research experiment where people were denied care. And if you don't get the vaccine, then in many ways you're, you know, repeating what Tuskegee did. Mm-hmm. If their concern is the vaccine, and most of them are worried about safe and effective, then I explain to them that we know for sure what this vaccine will do in the short period of time we've had it. We also know what this disease will do over the last year. And if you look at what the disease does compared to what the vaccine does, at least in the short term, I want the vaccine. Now, I also, I'm upfront. I said, look, I don't know what's going to happen 10 years from now, but I can tell you this, that the disease is, you know, if you get this disease, even if you get a mild case, you know, many of those folks have significant symptoms for months. And so getting the vaccine, which is very safe, you know, millions of people have gotten this vaccine. over 300 million people worldwide have gotten it so far. And this is one of the most safe vaccines that we've seen in terms of preventing you from getting seriously ill or hospitalized, and even reduces dramatically even mild illness in most people. So I think from a safety perspective, it's demonstrated itself in the real world. And is it effective? Absolutely.
So here's my question when you talk about vaccines and the perception for the general public. I remember as a young child in elementary school getting the vaccine. I believe it was polio or what have you. You had the great big gun and you got the shot in the arm, and everybody did it. I didn't hear anybody complaining about it. There was no social media. The news only came on once a day. We didn't have a 24-hour news cycle. And this is to both of you, and I'll put this to Dr. Benjamin first. What happened between those days when the vaccines were given out en masse? Specifically, let's talk about polio. And now, what has changed?
Well, we've always had people that have been concerned about vaccines. We've even had people concerned about wearing masks. But what's changed dramatically is that people haven't seen these diseases because we've been so successful with vaccines. People used to be so fearful of measles. People were very, very fearful of polio. There was a big national campaign over polio. Remind you that FDR, one of our presidents, got polio. So the world was very much concerned about polio. And we've done a very successful job of getting rid of polio. Smallpox, we've eradicated smallpox from the face of the earth.
Measles, for example.
But measles is an excellent example. Now, people are not getting vaccinated as often as they need to for measles. And now what are we seeing? We're beginning to see outbreaks of measles, which we really hadn't seen for many, many years in our country. So I think some of that is an issue. By the way, many healthcare providers, because we've been so effective at getting rid of these diseases, have never seen a case of these diseases in their clinical practice. Mm-hmm. So people are downplaying the impact of those terrible diseases.
Mm-hmm. In addition to those excellent points, Harold, coming out of World War II, America was fully optimistic and embracing of science. We knew then that we were building a new nation, building a new future, and the basis of that was scientific progress. And so there was an embracing of not only science, but of scientists. They were special in our society. Over the years, that has eroded. It has eroded, of course, as you've mentioned in your setup for this question, because of the predominance of social media, a distrust of elites across our society by multiple different population groups, and a sense anymore that we just don't have the same confidence as a nation that we used to have, and we don't hold up our so-called elites in the same way we did before. This world has changed drastically. And then there are, on social media, the opportunity for people to spread an enormous amount of misinformation when it comes to our community, deliberately targeting us with misinformation and misideas, and finding willing people to buy into conspiracy theories. And so it is very hard then to overcome all of that. But at the end of the day, Harold, I think what this really is starting to get to for me is that we have got to have a conversation with Black America about science and innovation. We need those tools to be able to save our lives, to give our lives the best chance to close these health disparities, to live the lives that we want. And ultimately, the progress of science is so rapid, so overwhelmingly advanced, and it is advancing every day. We see it in our consumer technology goods. We see it in the way products are made. We see it in the way farming is done. And we, of course, see it in healthcare. Somehow, as I conclude this answer, Harold, is that we have to find a way to not have scientific progress be a problem, but be something that we can embrace. And that means we're going to have to go back and really look at the education system, and particularly the science and math courses that are taught to African Americans all across this country.
Dr. Tuckson, why is distribution seeming to be so problematic right now? You just talked about all of these scientific advances and the vaccine, becoming available, so quickly and carefully. But why is it so difficult to get shots into arms? Is that a logistical thing? Is it a political thing? Is it what?
In fact, it is all of those things, and you just put your finger on it. And Dr. Benjamin sort of alluded to it earlier in the show. Number one, know that it takes time to produce these. These are not substances that can be just snap your finger and produce them. It takes time. The production cycle is something that you have to build in. So thank goodness we are moving very rapidly in that production cycle. So it's a matter, first and foremost, of just absolute supply. Number two, it was political. It was the absolute ineptness of the Trump administration, who could not understand, even though they had been told 1,000 times, about how the connection between the federal apparatus, the state apparatus, and local counties and city health departments, all of those have to be involved in the process, and they ignored that, and we have a broken system. And then third, unfortunately, the way in which you can become eligible for these vaccines, you need to register in most places. And registration has been something that is required online. African Americans too often have suboptimal internet connectivity, or a lot of our people do not have computers or do not know how to work the system as effectively as they should. And so what I would just say in that regard, I'm begging all of our young people here today, every young person that can hear us, please help your grandma, help your parents to be able to use the computer and register for these things when they need help. Don't leave the older folk to fend for themselves. We're all in this together.
Mm-hmm. Dr. Benjamin, let's talk a little bit more about vaccines. Some of the latest reports about AstraZeneca, that vaccine, which has not been approved for use in the United States. Some 7 million doses administered in Europe. There have been at least 36 individual reports of some blood clotting. 7 million versus 36 reports. That is a minimal amount. And yet, should that still be something that we are concerned about as we look at the possibility that AstraZeneca's vaccine could be approved in the U.S.?
Well, absolutely. And, but I think the first thing is to know that there's not been a shown relationship between those blood clots and the vaccine. But this is the way we do this. When you have any kind of complication that is of concern, then they stop using the vaccine and they investigate it. And then once they prove that there's no relationship, or if they understand that there was a relationship, but that it is something that it is an acceptable risk, then they continue. But this is not unusual. And of course, when this is brought to the United States, all of that information in the U.S. will be reconsidered by the Food and Drug Administration, and they will look at all of their data. They will go through all of their files. They'll look at all of their numbers, and then they'll make a recommendation about whether or not we should use that particular vaccine. And then if they do, under what conditions.
Mm-hmm. Do you believe that we may get to a point that we will see the use of COVID-19 vaccines in the same way that we see flu vaccines every early fall? You need to get a flu vaccine.
Well, let me point out that one thing I should have said about the AstraZeneca vaccine. By the way, it's not an mRNA vaccine. It's a different formulation. And there are several different types of vaccines that we're using for COVID. So that's important. Second thing is, we don't know yet whether or not we'll need booster shots, basically what you're asking. The flu virus changes pretty regularly every year. We are seeing these variants that are occurring all over the world, and as well as here in the United States. And if they become more prominent, then we very well may need booster shots. The good news is that the technique, the science around making those boosters for a virus that's changed, a variant virus, is pretty easy. And those drug companies right now are already experimenting with ways to adapt the booster shots to the new virus, should we need to do that. Now, your question is whether or not we'll need, this shot every year or every couple years. And the answer is we don't know yet.
Yeah. But what about the treatment? Because there's been a lot of news, we've covered it, about the vaccines, and you don't hear a lot about the treatment of people who have been infected. And the reality is people are still dying. That has not changed. So are there any, are we still treating this disease for those people who have been admitted into hospitals in the same way that we were 6 months ago?
Absolutely not. One of the other marvels of science that is not getting the attention that it deserves is the fact that we have truly learned much better how to take care of people who've been infected with COVID. There was a time when we basically gave people supportive care. That means we fed them, we gave them fluids, and if they had trouble breathing and their lungs were collapsing, then we put them on a respirator. We discovered that, putting people on respirators in many cases, not all cases, but in many cases, was not a good idea. We learned how to better manage the airway and the lungs. We also learned how to tamp down the inflammatory response, because what this virus does, it creates an enormous inflammatory response in our bodies. And we've learned that certain types of steroids helped address that. They've learned how to take antibodies from people who have been infected and manipulate them and then give them back to people who have been infected. Those are the monoclonal antibodies. And they're now learning that if you use different kinds of monoclonal antibodies as kind of a cocktail of 2 or 3 different types, you can even get better results. So the clinical care for this disease has dramatically improved. The other thing is, of course, I'm gonna put my public health hat on and just remind us that the best thing to do, of course, is not to get the disease in the first place.
Right.
So that's wearing a mask, washing your hands, keeping your distance, for now not getting in big crowds, and getting vaccinated.
Hey, George, let me just quickly add it.
Real quick, because I'm running out of time.
We need to be advocates. That's all. I want to tell all of our family members, be advocates for your family member if they do get sick, to ask about those monoclonal antibodies and other things to make sure we get access to the drugs that will save us. If we have to fight for those things for our family.
Real quick, Dr. Tuckson, and same question for you, Dr. Benjamin. I'll give you about 20 seconds or so each. How do we move beyond where we are now? From your perspective, Dr. Tuckson, first.
We number one, we get vaccinated when it's our turn. Absolutely, we do that. Number 2, in the interim, continue to wear your mask and social distance and all the things that George Benjamin just said.
Wash those hands and the whole nine. Your perspective on that, Dr. Benjamin, as well. How do we move beyond where we are right now, 1 year later?
Yeah, we demand that our political leaders and the resource allocators give us the resources to build a public health and healthcare system so that the next time we have one of these diseases come into our community, that we can rapidly identify it, get our hands around it, and respond much more effectively than we did the last time. And by the way, this is not this is not the last time we're going to see a disease like this.
Indeed. Gentlemen, I want to thank you both for participating in this conversation and being a part of our first panel of experts. I really appreciate your time. We are going to take a quick station break, and we're going to say goodbye to our WHUR audience. And when we come back, we're going to shift gears a bit and drill down more on the human toll of the pandemic and how we recover mentally. COVID-19, 365 days later, will continue in just a moment. Thank you for staying with us for our monthly special edition of the Daily Drum with our sister station, WHUT-TV. Our discussion tonight is COVID-19, 365 days later. And again, we want to remind you that we're not taking any phone calls, but we invite you to join us on social media using the hashtag COVID365. In this segment, we're going to take a look at the human cost of the pandemic and how we respond to what's likely to be a lingering psychological impact that will be felt for many, many years to come. I want to introduce you to our second panel, Dr. Frida Lewis Hall. She's a trained psychiatrist and life scientist leader who has held roles in academia, medical research, frontline patient care, and a global biopharmaceutical company. And also Dina Taveras. She's a Prince George's County Council member representing District 2. She is also vice chair of the Prince George's County Council. She joins us not only as a lawmaker and a public servant, but also as a person who knows all too well the toll the pandemic has taken on millions of families. Ladies, thank you so much for joining the conversation. I appreciate your time.
Thank you for having us.
I want to start with you, Council Member. And this is a really delicate situation, and I appreciate you coming on and opening up to us about some difficult private issues. You have lost 6 members of your family to COVID-19 and have had 16 members infected. How do you, as a public servant, do your job and maintain your sanity, your mental health when you are bearing the burden of this horrible loss?
Hello to all your listening audience, and to Dr. Lewis Hall. It's an honor to be with you this evening. For me, it's been difficult, right? The thing is that I come from a family of immigrants. We come from strong stock, and we're people that know how to survive, right? So, I mean, you have to, in this particular situation, you gotta compartmentalize, on how to do things. And so when my community, which is the hardest struck in the entire DMV, we have basically, I have the smallest district in all of Prince George's County, and 1 out of every 5 county residents that's infected by COVID lives in my district. That's just to give you a scale of the level of contagion that exists in my community and where I currently live. And my zip code right here where I live is the zip code with the greatest level of contagion in all of the DMV, Virginia, DC, and Maryland. So to speak to that, I just couldn't. I couldn't stand by and not do anything. I couldn't go into myself and just feel myself, even though I had the right to. So, we had to be able to respond. We had to be able to come up with food, rent assistance, help, medicine for COVID-19 families. I had households that had 10 people infected. We've been able to provide over 2 million pounds of food here in my district over this last 365 days. So I can tell you, I didn't have time to mourn.
No time to mourn. Have you taken a moment for yourself? Because the need is still there. All of the things you just mentioned are still critical. And even though we see some changes happening in Prince George's County, my father used to say, you can't help others unless you take care of yourself. Have you in some way, shape, or form been able to take care of yourself so that you can continue to serve the constituency that elected you?
Well, I believe in proper mental health. So I have someone I talk to, and that allows me my ability to vent and keep my mind bright and sane. I do something very small, but I think to me means a whole lot. I have to be able to watch comedy every single day before I go to bed. And that helps, right? Being able to laugh, smile, joke at the politics. To me, I gotta do my run of like either the Daily Show with Trevor Noah or Stephen Colbert or the Seth Meyer, I got to do at least something, to make me laugh and smile and get me recentered. And so it may be small, but, it goes a long way.
Indeed, it does. Dr. Lewis Hall, I remember watching this press conference last year where Dr. Anthony Fauci was asked a question, and his response was the next pandemic will be the mental health pandemic. And here we are some 7 or 8 months after he mentioned that. And it seems to be coming true for so many people. How do we get a handle on what may be a coming mental health crisis?
So, as is often the case, Dr. Fauci was right on. The mental health pandemic is not coming, it is here.
Okay.
And if you think about our community, first let me say how sorry I am to hear about all of your losses. It's tragic what happens in our community to our families, and your bravery and service is so we're so grateful for collectively as a community and as a nation. So I just want to say thank you and how sorry I am for your loss. We as a community are deep in the throes of a mental health crisis. The fear of COVID alone takes its toll. Our living situations in multi-generational homes, where we're caregivers to the young and the old, where we are disproportionately represented as essential workers on healthcare fronts and transportation and grocery stores and manufacturing. All of this puts us squarely in the path of a COVID infection, hospitalization, and death. And add to that we've been disproportionately affected by the economic pressures and tolls of this pandemic, with increased job losses, lowered wages or lost hours to the pandemic, the cost to small businesses. We can go on and on about the economic loss. And we shouldn't forget the additional pressure of being confronted with so upfront and personal with racism as a systemic health issue in this country, as a health risk. And start adding to that separation and isolation from our friends and family, grief at the loss of friends and family, and on top of that, the inability to support and grieve in the way that we're used to. And then last but not least, if none of those things have touched you, just plain living will get you. If you think about childcare, what am I going to do about my child's education? How am I going to get care so I can go to work? What am I going to do if they become ill? What about their mental health? What does this mean for their future? They've already been called the lost generation. And our security, kind of our living circumstances, our family's health and security, and the list goes on and on. So we are under pressure in an incredible way. And the crisis was already headed our way. In 2018, there was a study that said, this is pre-pandemic, 69% of African Americans who had mental illnesses were not able to get mental health treatment. 42% of those with serious mental illnesses were not able to get care. And 88% of substance abuse, people who suffered with substance abuse were not able to get care. So if you add all of the things we just talked about, those additional stressors and pressures, a system that's kind of underwater with the care of patients with COVID, stigma, economic and access pressures, the mental health pandemic is here.
Mm-hmm.
And if I could just add,
please go ahead.
I don't want to forget to the mental health stresses of also the children that are virtually learning. Just in my district alone, we've had 1 attempted suicide and 3 completions by ages of 10, 13, 15, and the attempted was a 12-year-old. So that also speaks to the level of stress that our community is under.
Who are you most concerned about it in your constituency, a council member, and what specifically are the biggest needs that have been brought on by the pandemic?
Well, I'll be honest, I'm not just concerned about my district, I'm concerned about the county. I think the county itself as a whole has disproportionately suffered as a county that is 80% a county of color. That speaks to how many vaccines we've received. How can we, as the county that has received the most amount of we have had the greatest level of contagion in this county, the greatest number, some of the most highest amounts of deaths here in the county, and now we have the least amount of vaccines and vaccine coverage here in this county. So, and that's why I'm determined as a council member working with an elite team to provide a solution that will be equitable at a national level that we can employ, not just countywide, but statewide and nationally wide, to address some of the concerns that were highlighted actually in your previous discussion.
Well, as you know, the governor has this equity task force for.
You got the answer.
Yeah,
I'm about to talk to him in a week or so.
I'd be really interested in hearing what you have to say to him, because is it working?
Well, what we're trying to propose is tackling the problem per household and on a community basis.
What does that mean per household?
So right now we're targeting people by ages, 75 and older, whether you work in a certain job or not. That's not working. It's clear it's not working. The systems are not working. Nobody's talking to each other. I don't want to digress here. I think that this may be another topic, but the thing is that we need to bring an engineering solution. And I've brought some of the brightest minds in the country to come and tackle this, and brought in, and I'm talking now to folks at Bowie State, at the University of Maryland, to come in and do the last leg. But what we need to do is have engineering systems in place that communicate with each other. That's the first thing. The second thing is we got to tackle the problem in a community. We've got buildings here we can put in place in each community and say, you know what, instead of you standing in line 6 or 7 hours or driving 5 hours away, you can go to your neighborhood building, community center, and you could get vaccine. Or everybody in every apartment, everyone in every house can get vaccinated at one time. And the safer route, where you're attacking the problem holistically, not just by the grandmother's not done, but the children, the mother, the caretaker's not taken care of. Everyone in the household is taken care of. And by that way, you're taking care of your teachers. If the children go back, your essential workers, because they interact with the public, your caretakers inside the house, you're treating the problem holistically.
And all of those things would, if they happen the way that you're proposing, would bring us back to the issue of a sense of safety.
We could deliver 600.
Feeling emotionally stable, because that's one less thing you have to worry about. Yeah.
And we could do about 600,000 vaccines in 20 days based on this plan that we've developed.
Dr. Lewis Hall, who are you most concerned about? Is it the children? Is it the mental health workers that we don't hear so much from anymore, who are still in the trenches of the hospitals and the nursing homes, or is it the parents of those children? Your thoughts about that and the mental health?
Yeah,
yes. Okay, there you go.
I'm concerned. I'm concerned about all of them. I'm very concerned. We just heard a story of significant family loss, and someone who said we're, strong and got to keep going, got to keep moving, got to walk it off. And I am most nervous for those who are serving in some capacity as caregivers, as parents, as people who are in the workplace, as healthcare workers, as, you know, everyone that is continuing to apply themselves despite the fact that they themselves are under tremendous weight. My grandmother used to say, similar to your father, if I set myself on fire tonight to keep us warm, what are we going to do tomorrow when it's cold? So for everyone that is kind of out and fighting this, to remember to do self-care. And we do need to build a new normal for ourselves. I hear a lot of people say, you know, when do we get back to normal? I don't know if normal is what it used to be. And my mother used to say, don't let the storm disrupt your journey, let it clear your path. So I think that we have an opportunity to think about, okay, this is not what we planned. It's not what we were looking for. Self-care is really important. We have to be sure that we're able to stay in for the long haul. We need to be sure that we continue safe recommendations. We do not let our guard down now. We cannot let our guard down now. And we can begin to think about what some of those healthful and self-care platforms look like for us. So what might we be able to do to take care of ourselves in this new circumstance? So how do I eat better despite that, you know, that food might not be secure in the same way that it used to? How do I exercise? How do I practice mindfulness and stay connected with my loved ones in new ways, create new traditions? So all of these things, I think, are a part of how we'll allow ourselves a steady state, if you would, staying the strong foundation that our families and our community need, but also at the same time to take care of ourselves, because we're not near done, right? We've got a ways on this journey to go still.
As a psychiatrist and as a Black woman, you know that, you know, historically, mental health was just not something that was openly discussed in the Black community. And seeing a counselor, psychologist, psychiatrist, you know what was said. You know, Black folks don't do that. Mm-hmm. Do you believe that this storm, this COVID-19 storm, has helped communities of color transition from the issue of stigma to the reality that this thing has hurt me emotionally, mentally, and I need to talk to somebody, and I don't mind talking about needing to talk to somebody?
I hope that that is the case, and I would strongly encourage people to look carefully at themselves and their ideas of stigma, and also to be sure to be supportive and mindful of friends and family members who may be showing signs of wear, if you would, changes in sleep, being overly anxious, irritable, blaming others, feeling distanced, not the social kind, but the other social kind, like just withdrawn, changes in appetite or changes in weight that can't be explained in other ways. And this should be a moment where, as serious as a cancer or diabetes or lupus or any other of the many diseases that disproportionately affect us, we have to be on the lookout for this because help remains available. We can reach out to friends, family, community leaders. There are hotlines and helplines. Telemedicine has begun to do a lot of work in the area of counseling and care. So I'm trusting, not to keep quoting folks, but my husband says, people don't change when they see the light, they change when they feel the heat. And this has certainly been some heat, and perhaps it'll change our minds about mental illness not being a weakness, and getting help not a sign of weakness.
What change, council member, have you seen in the county, and more specifically, perhaps in your district over the past year, positive change that may have surprised you or made you say,
I wish I could point out to something. I know that at least in the county, people found ways for us to go to church in different ways and serve. I think that we came together as a community, right? I think that's what was so beautiful, that we were, on a weekly basis, I pulled a team of 227 volunteers weekly to work and serve the community in food drives that we did. We had like 9 food distribution sites weekly through until August. Now we have 6. And so we've got all hands on deck. And that was what to me was beautiful. But in hearing, I may have to hire Dr. Lewis. Oh, goodness. She hit it right on the money. I was like, woo!
It's the heat. It's not the light.
I know. I said I gotta take down these quotes, but in full disclosure, I'll speak to it very transparently and honestly. My family does suffer from mental illnesses, and that's something that is very strong in my family. My mother committed suicide, so those are issues that are very close to me personally. And the thing is that those were issues that were not discussed in my family. And I think I wouldn't just say that that's the case in communities, in African-American communities. I will say that that's the case in all communities of color, that there is a stigma. The fight I have, or at least the tug and pull, if you will, is that, like the doctor said, is I've been in environments where folks have said, oh, you could pray it all away. Right. And I think that these kinds of issues, the depression, whatever, I think that those are issues you've got to tackle head on. You gotta have in your pocket, you got to have a therapist in one pocket and a psychiatrist in the next.
Yeah.
And walk with both of them.
Well said. I'm getting ready to close out, and I wanted to allow both of you at least a quick 30 seconds to talk about your thoughts about a realistic approach moving forward when it comes to mental health and the pandemic. I'll start with you, Dr. Lewis Hall. 30 seconds moving forward.
So I want to re-emphasize self-care. I also want to say there are such things as mental health emergencies. If anyone, you or someone in your family or a friend, is talking about hurting themselves or hurting someone else, please, please, please get them help. And make sure that you help smooth the pathway for people to believe that they can and should get help and get them to it.
Mm-hmm. From your perspective, council member, and you are, as I said, a public servant. You are a lawmaker, but you are intimately connected to the difficulties of where we are right now. What would you say is the best way for the community that you serve to move forward when you're talking about mental health?
I do think that getting professional help is critical. I know that not everyone is capable of being able to pay for that. But there are community resources that are going to be available, and they will be available soon. And I hope that everyone takes advantage of those resources. will be available. And we do have other resources, that alleviate some of that stress and pressure. We have a rental assistance program. We have programs helping, provide you to pay your utility, your water, your electricity, those kinds of things. So those two, look out. The thing is that sometimes, because we're in a state of desperation, we don't have time to step outside and look what's out there for help. And the help exists. And we're able to fix those problems. I mean, think about it. Our county now has $25 million. That's more than all the money that's been paid in all of Prince George's County, all of last year. We just got that now.
Okay.
We could pay 6 months worth of rent.
Yeah. Well, and it doesn't hurt to help each other either. And I think we can all agree on that. We are out of time, and I wanted to thank the two of you and all of my guests for sharing their time and expertise with us. And we know this for sure, that this pandemic is far from over, and we all have to take a collective responsibility in not only protecting ourselves, but also safeguarding others. It is not a difficult choice. I want to thank you for joining this discussion. I'm Harold Fisher. Good health to you, and good night.
This program was produced by WHUT and made possible by contributions from viewers like you. For more information on this program or any other program, please visit our website at WHUT.org. Thank you.